Okay, hello everyone. This, as promised, is the second part of the lecture that we started on Monday of this week. It's about building a shared terminology. So I'm going to start sharing my screen here and get going. All right. Share screen 2. Okay, perfect. So first things first, there are a couple of different types of terminology that we'll be referencing in this class. And they are really thinking about terms that apply in the research context to LGBTQIA plus populations, as well as to the community context, which I think also often is the clinical context in terms of language. So we'll start off with one of I think the first readings that was assigned for this first week, which has to do with the research side of things. So you see here that the National Institutes of Health definition of sexual and gender minority is that sexual and gender minority populations include, but are not limited to, individuals who identify as lesbian, gay, bisexual, asexual, transgender, two-spirit, queer, and or intersex. And if you recall from the syllabus, we have one of the learning objectives is listed as that all of the different populations covered in the NIH's definition of SGM, as we like to say it in the research world, will be addressed in this course. You also see that something else that we'll talk about today is covered in this definition, which is that individuals with same-sex or same gender attractions or behaviors, and those with differences in sex development, are also included. Populations who encompass those but don't self-identify with one of the terms listed, whether sexual orientation, gender identity or expression, or reproductive development, is characterized by non-binary constructs of sexual orientation, gender, and or sex, is also included in the NIH definition of SGM, which, as you can see, is very broad-ranging and multidimensional. But that's something I think by the end of this course, if you're not already able to do, you'll be able to unpack everything there by the end of it. So jumping in a little bit more. So you'll notice the difference, the research context as SGM, the community and clinical context. You can see some various permutations here, starting with LGBT or lesbian, gay, bisexual, transgender. And by the time we get to the bottom here, could be lesbian, gay, bisexual, transgender, queer, intersex, asexual, and two-spirit. And plus indicates that there would be more identities or communities that are included under the umbrella, and that the acronym is really meant to reflect an umbrella that moves beyond cisgender and heterosexual persons. So digging in a little bit more into those dimensions that were noted in the NIH definition of SGM, this is a starting point to start building our terminology and our conceptualization of sexual orientation and gender. I think it's important to say that all of them are multidimensional and that everybody has one. Terminology varies, and they're three different things. In terms of sex, a lot of people, this is the one they think it's multidimensional, but when you start to really think about it, there are lots of different components of sex, including genitals, chromosomes, secondary sexual characteristics, so breast development, voice tone and timbre, fat distribution, etc. Those would all count as secondary sexual characteristics, hormone status, and what hormones you have and at what levels in terms of the sex hormones and steroid hormones, as well as identity. And identity in the context of sex, again, you might think, how is there an identity for sex? But if you ask people to name their sex, they might say male, they might say female, they might say intersex, which is something that we'll dig into. But the idea, why is it that people will tell you that? Because it's listed on their driver's license, it's listed on their birth certificate, and it says typically sex. And so people get an idea of their sex often from a very young age. And this, in the United States, it's a status that's assigned legally and medically at birth to people. And people then will take that up and say, yep, that's what it says in my form, I'm male. Then next up, we have gender. So there are at least two different components of gender that we're going to talk about in this course, and they include gender identity and gender expression. So gender identity has to do, as it says, with people's sense of their gender. Do they consider themselves a man, a woman, non-binary, agender, another gender? And then that's in contrast to gender expression, which is about how people present themselves in terms of dress, behavior, mannerisms, speech, etc. And this gender expression can vary, and again, it's on a spectrum often. And there are lots of different combinations of gender identity and gender expression. So you can see the bottom graphic here, which I believe was created by the Wentworth Institute, just the different combinations of people's gender identities, which aren't listed here, but their expressions. And you can't tell, it's important to say, you can't tell somebody's gender identity from their gender expression. It's important if you want to know somebody's name or pronouns that you ask those questions. And gender expression also can vary, just like gender identity can vary day to day. So gender expression, we'll unpack this all a lot more later on in the class. So yes, just want to emphasize the point, don't make assumptions. You can't tell somebody's gender identity from their gender expression. So now moving on to sexual orientation, there are three large components that often get talked about in terms of sexual orientation. The ones that I think people are most used to hearing about are identity and behavior. So sexual identity would be a component of sexual orientation, like how do you identify your sexual orientation? For me, that would be bisexual and aspectrum. For other people, it might be gay, lesbian, straight, heterosexual, depending on what words people use. Talk about how they see themselves. Then there's also behavior, and behavior has multiple dimensions to it as well. It's not just who do you have sex with or do you have sex. It's also about relationships and partnership formation. What are the gender or genders of people you partner with in various ways, etc. Romantically, sexually, platonically. How do you form family? That would also fit under behavior. And then under attraction, there are multiple dimensions of attraction as well. You may imagine romantic attraction, who do you have crushes on, who you fall in love with. There's also sexual attraction. Do you experience sexual attraction? Who are you attracted to, etc. That was all under sexualization. You can see here what I was just saying, but in a different format here, showing that they're overlapping, and that I think a lot of times the stereotype is that identity, behavior, and attraction would all fit social stereotypes of what people think those definitions of would mean. Like starting with, if you say the word gay, people think you have, you would say, first of all, there's an assumption about your sex and your gender right off the bat from that word. Following that, there are assumptions about who you'd be partnered to, who you'd have sex with, who you'd have a romantic attraction to. But those are all, that's a lot of assumptions for one word, right? And as you can see from this Venn diagram, there are many combinations of identity, attraction, and behavior that people can have. And again, I want to go back to those slides about sex and gender, and they're also multidimensional. And to understand sexual orientation in the US context or from a Western view, you have to also understand gender. So broken out here, I wanted to break out sexual orientation in a couple different ways. So you can see here some of the components we talked about just now, and I have some questions to help prompt you for thinking about it. But I wanted to really contextualize this self versus others distinction for sexual orientation. So with sexual behavior and relationship history, so with these behavior dimensions, they can be viewed, as interpersonal. In terms of if having sex with another person, having a romantic relationship with another person, that involves more than just self. It's an interpersonal connection. Same thing with marriage, with various relationship structures, whether it's monogamy, it's non-monogamy, polyamory. You can also think of BDSM and kink as falling under the behavior realm and relationship formation realm in various ways. And these are dimensions of sexual orientation that when people think about them, they're the most visible, they're easiest to see because they're interpersonal. So sometimes these even get called objective measures of sexual orientation because of the fact that it can be measured and observed beyond the self. But then we're thinking about the self here and thinking about identity, attraction, desire. These things are intrinsic and internal. And so when we are thinking about how to measure sexual orientation, I think actually surveys would show that the single most common dimension that's often measured is sexual identity. And that's a subjective, self-based term, right? Sometimes and I think that's a good thing because it really tells a lot about, it's both a self term and it's relational because of the idea of how we understand our identity is influenced by how we see ourselves in relation to society and what identities are even available to us. But I just want to make this distinction too, because these are the unobservables in some ways that people can that are important to people that people talk about, but they're not interpersonally observed. And I do think I've come to believe over time that differences in dimension, the self versus the interpersonal aspects of sexual orientation, are at the heart of oppression of bisexual and asexual people, and of any people whose identities, behaviors, attractions, etc., don't align to social expectations and norms and binaries. Anyone who breaks that, I think, falls into some unique types of repression that we'll talk throughout the course later on. But okay, the other thing, obviously, that is important when you're thinking about measurement of sexual orientation, or if you're a clinician, you want to think about asking the right questions to your patient, is thinking about time as a component of or dimension of sexual orientation. Because if you ask somebody who they had sex with in the last minute versus who they've had sex with in their entire lifetime, you're going to get very different answers. And so depending on the questions you ask, you might be making different categorizations or assumptions about somebody's sexual orientation or health risk profile, et cetera. But you would need to think about in what way is this time meaningful for the questions that you're asking. And for many people, answers to the questions about their sex, about their gender, about their sexual orientation in different ways can be fluid and change over time. So it's another important way that time is a dimension of sexual orientation. So going now into some different identity terms. So some of these were included in that HRC reading that you saw with the terminology. I'm just going to have some quick notes here, and you can read through that as well. But intersex individuals have sex characteristics that deviate from typical definitions of male and or female bodies. What you're seeing here is a graphic of the intersex pride flag. So, and then typically the way the question would get asked, we talked about this a little earlier about medical legal sex. People would ask on their birth, on a birth certificate or on a government form, or when you're getting your driver's license, what is your sex? And in most jurisdictions in the United States and in most parts of the world, you have two options, male and female. Increasingly, jurisdictions, including the state of Illinois, beginning in 2024, will have another option of non-binary and or X. So it won't just be so limited as it has been historically. Gender identity, we went through this a little bit earlier, but I wanted to give another, just to reinforce the definition and then give you a paper if you wanted to cite this definition, which comes from the American Psychological Association. So gender identity, a person's deeply felt inherent sense of being a boy, a man, or a male, a girl, a woman, or a female, or an alternative gender. Okay, well, that's fine. Gender queer, gender nonconforming, gender neutral, that may or may not correspond to a person's sex assigned at birth or to a person's primary, secondary sex characteristics. So if you're looking for a citation that you want to put in a paper or whatnot, you could use this. More gender-related terms. So transgender and cisgender are important concepts and definitions here. So transgender defined as an adjective. It's not a noun. People aren't transgenders, so it's an adjective to describe a diverse group of individuals who self-identify as a gender minority or whose gender identity is different in varying degrees from their sex assigned at birth. Cisgender means, in contrast, it's relating to or being a person whose gender identity corresponds to the sex that they were assigned at birth. So there's no difference between your gender and your sex at birth. If you're cis, there is a difference if you're trans. Then there's also a question of whether or not you identify as transgender, because the transgender identity is different than meeting this definition. People may or may not refer to themselves as transgender if they have a different gender than their sex assigned at birth. There are, for example, non-binary people who don't identify as trans, even though having a non-binary gender would be different than the sex assigned at birth as male or female on birth certificates historically. So just something to keep in mind. A transgender man is a man who is assigned female at birth on his original birth certificate. A transgender woman is a woman who is assigned male at birth on her original birth certificate. Notice here that people who identify as, people who could be classified as a transgender man or a transgender woman by these definitions may not personally identify as a transgender man. They may identify, as you see here, as a man or as a male. People use language different ways. And if you're not talking to a researcher, you're not talking to a clinician, et cetera, people might say, I'm a male, I'm a man. They may say I'm a transgender male, I'm a transgender man. It depends. This connects as well to identity and not only to these broader definitions. So it's what's important too when you're engaged, thinking about patient-centered care is that you refer to people the way they refer to themselves. So, and that you also are getting the information about their bodies and who they are to be able to think about physical health and mental health, social determinants of health, which all affects patient care and health and well-being. Okay, next up, non-binary person, an individual of any sex assigned at birth who identifies as non-binary. Non-binary people may or may not also identify as transgender. We just covered this. Some different identities that sometimes people who are non-binary also might have are gender non-conforming, agender, demigender, demigirl, demi-boy. There's a lot of terminology, that people may have. So non-binary can also be seen as an umbrella type term. And also not everybody who is non-binary, who is agender may identify as non-binary. There's a lot of intersections, and really the best practice is if you want to know how a given person uses the term non-binary, transgender, bisexual, what have you, you should ask them, just because if you think about those Venn diagrams that we saw earlier, knowing one word about someone doesn't tell you their full experience. So gender modality, this may be a term that you've not heard of, even if you're familiar with LGBTQIA communities and identities. This is a newer term that was coined by Florence Ashley, who's a bioethicist and legal scholar of Toronto. You can see the citation here for their work. So gender modality, it refers to the correspondence or lack thereof between a person's gender identity and gender assigned at birth. Cisgender and transgender are two primary gender modality terms, but the term overtly leaves the door open to discussions about other gender modalities, maybe potentially non-binary. So this is a term that is useful because you can say I am a man and my gender modality is that I'm transgender, if you wanted to talk about it that way. And you could say I'm non-binary, my gender modality is cisgender, I'm non-binary, my gender modality is transgender. Those types of possibilities open up with this term, and I really like it. So I included it here. Sexual orientation is defined, just this one broad umbrella, is an enduring pattern of romantic or sexual attraction or a combination of these persons of a different gender, the same gender, or multiple genders. I wanted to include, because of also this community frame and the person first frame that we have, I think it's important that people are be able to recognize and use in an inclusive manner the different pride flags that are available. So you see here, like the basic rainbow pride flag. This is used a lot. Sometimes it's meant to be used as an overarching inclusive flag for LGBTQ communities, but increasingly, I think there's variations. So like I personally like the progress pride flag shown here. And you can see the colors there. First, these are the trans pride colors shown in these three arrows pointing inwards, and then black and brown stands for racial justice. And so inclusion of Black and Indigenous people of color within the community's intersectionality, and then over the overarching the rainbow pride flag. And then this is one of the versions of the lesbian pride flag. There's also a battle axe version of the lesbian pride flag. This is the bisexual pride flag. This is my big pride flag that I love. Pansexual pride flag. There's asexual pride flag, a demisexual pride flag. We'll go through some of these terms in a moment. a romantic pride flag, but we'll keep on going to pride flags throughout the class. These are important too. If you're thinking about community engaged research, you should know what these are. If you're thinking about patient care, you should know whether or not patients are going to see themselves in the symbols you post for pride. I don't see myself in the rainbow pride flag. I don't even really see myself in the progress pride flag. And that's important to me. It's important to say because I'm a bisexual person, and bi people experience exclusion not only from straight communities, but also from LGBTQ, but really more gay and lesbian communities. And so for me to see myself and know that there's a signal for me to feel safe and included, I need to see my pride flag. And there's a lot of variation in that people have depending on their identities, how they feel seen. Okay, so more terminology. Gay describes someone who's attracted to people of the same sex. Gay is usually used to mean men who are attracted to other men, but it can be used more broadly. Sometimes it's used by women to say that they are attracted to people same sex, have same sex attraction, same gender attraction, etc. as well. And lesbian is also used to describe typically a woman who is attracted to other women. And then heterosexual or straight is describing somebody who is attracted to people of a different sex. So a man who's attracted to women or a woman who is attracted to men is typically how those terms get used. A definition of bisexual that I like best and actually use myself is from Robin Oakes. So Robin, says, I call myself bisexual because I acknowledge that I have in myself the potential to be attracted romantically and or sexually to people of more than one sex and or gender, not necessarily at the same time, not necessarily in the same way, and not necessarily to the same degree. And so you see in this definition that attraction is specifically referenced and that there are multiple dimensions of attraction referenced. So you can be, in this definition, multi-gender attracted, and you can also not have to experience both sexual and romantic attraction. You could experience one and or the other. And so this allows people who are asexual or aromantic to also identify as bisexual and be able to fit in this definitional umbrella that Robin has created. So pansexuality, there's a lot of overlap between bisexuality and pansexuality. Both are identities that are associated with multi-gender attraction in some very broad ways. Oftentimes, pansexuality is defined to attraction to all genders or attraction to all sexes under genders, attraction regardless of gender. It's not centering gender. People who are bisexual certainly can use these very same definitions, like myself, for example, but may not identify with the word pansexual and vice versa. There are some people who identify as pansexual, others who identify as bisexual. Robin identifies as both. You don't have to pick a side. So it's important to just keep that in mind. And identities are really meant to be terms that allow people to define themselves and to position themselves in relation to community and to find community. That's labels at their best. Labels at their worst, of course, when it comes to these sexual identity terms, people may decide the problem is that, with saying identifying as pansexual versus bisexual is that other people are identifying themselves wrong. And so there's a fight sometimes in the community about these terms, but really the fight shouldn't be within our own communities. It should be with the overarching culture that would say, that people who are LGBTQIA in various ways are bad or wrong, or, we wouldn't be fighting about how to define ourselves if stigma didn't exist. So I'll leave it at that. And a little tangent there, sorry. So with queer, it's a word that's used in many ways. It can be used as a community umbrella term for everyone who's not cishet or heterosexual and cisgender, longer way to say that. It's sometimes also specifically used increasingly as a term to mean multi-gender attracted people, or it's used to describe genders that are non-binary, sometimes both. It depends in what context the word is used. It's also a political term. People may say, I have queer politics, I'm part of a queer nation, etc. If they say that, they're using it in more of a political term. And it can also be it was formerly, especially if you're talking to older people, this may not be a welcome term to hear because it was used as a slur. And it might be bringing up painful memories for some folks, but increasingly, and this has been true, I shouldn't think it's been true for at least the last 20 to 30 years, that queer is used and has been reclaimed and used as an identity term or a community term, an umbrella term in a variety of ways. So sexual fluidity, we talked a little bit about this earlier. So time is an important dimension of sexual orientation and gender. And so we are looking here at these definitions that come from the advocate, that are coming from people's descriptions of their identities. Sometimes people may actually identify as sexually fluid or as sometimes just as fluid. And it really is referencing the fact that, for example, this personal definition, I identify as sexually fluid because I experience significant changes in the attractions and desires I have for people of different sexes and or genders over time. So the actual change and the shifting of attraction and desire for this person is the defining factor of their sexual orientation. So they identify as fluid. So there are also people who refuse labels for sexual orientation, and they might say things like, I don't like being put in a box. My sexuality is more complicated than a label can capture. Even our just the conversation we had earlier about one word means everything. What? No. So that's part of it. Sometimes I love people. You might hear people say some folks find labels stigmatizing because they feel, again, usually you hear that in the context of I'm being put in a box. And people may not wish to use a specific word to describe their sexual orientation, or sometimes people's identity itself seems to become no labels, which is a little bit counterintuitive, but just you might also see this. And oftentimes people who say no labels may also be multi-gender attracted. That's not uncommon, but it's not always true. Okay. So next up, asexuality. So this may also be an area, even if you are expert in LGBTQIA plus or SGM health, you might not know much about asexuality. But an asexual person is someone who does not experience sexual attraction. That's the very simplest definition. You can also see in this definition from AVEN, which is the Asexual Visibility Education Network's website, and then you can see the website of asexuality.org for AVEN. This definition also has, just in addition to not experiencing sexual attraction, this other piece saying, or an intrinsic desire, you don't have an intrinsic desire to have sexual relationships, or the adjective describing a person as such. So this is a broader definition. I think increasingly the community bases the definition of asexuality in terms of identity as lacking sexual attraction, but there's also people out there who are asexual who there's variation, I should say, among asexual people around if folks are sex positive or sex negative, whether they experience sexual desire, whether they wish to have sex. All of the, just like we had that Venn diagram about identity, behavior, attraction, desire that we showed earlier, that applies to asexual people too. So you can be asexual, you don't engage in sexual behavior, you don't experience asexual attraction. You can be asexual, you don't experience sexual attraction, you do engage in sexual behavior, and you do experience sexual desire. There's a lot of different permutations under the asexual experience and identity umbrella. There's also what are called spectrum or aspec or aspec identities. And so what does that mean? So it can be a couple things. So, and this is in terms of variations on the themes of sexual attraction and emotional or romantic attraction. So first, you can see demisexual. This is a variation on the romantic attraction. So it's someone who can only experience sexual attraction or desire after an emotional bond has been formed, like a romantic bond, emotional bond has been formed. Or you can use this as the adjective of describing a person as such. And this is different from the choice to abstain from sex until certain criteria are met. So that's an important distinction. There's also gray sexual or gray A, gray sexual, depending, there's a few different ways people use this term. But this is somebody who may experience sexual attraction at times and not as others. They may experience sexual attraction only rarely or at a low intensity. And so these are basically showing that asexuality itself can be on a spectrum in a couple different ways, hence asex. And people will sometimes combine these. It's not uncommon to see people who would say, I'm a demisexual, pansexual person. I am an spectrum bi person, or I am a gay asexual person. Like, you can combine different identities here because in part, both asexual and gay, for example, are identity terms. Asexual also, when used in that context, can mean the lack of sexual attraction. So hopefully that is helpful. You can go through that in more depth, or I can answer questions if people may wish. All right, next up we have romantic orientation. So just like there are sexual orientations that are hinging on people, asexuality is about not experiencing sexual attraction. In that definition, you can be aromantic, so you aren't romantically attracted to other people. And then you can also be heteroromantic, homoromantic, biromantic, panromantic. And these definitions tend to follow those definitions of heterosexual, gay, lesbian, bisexual, pansexual that we saw earlier. But rather than having the sexual part of that as the suffix, it's romantic because the dimension of attraction that's being referenced in the identity term, unpacking this a little bit, has to do with romantic feelings or romance compared to sexual attraction, if that makes sense. And you can also, just like you had with asexuality, with demisexual and gray asexual folks, you can have the corresponding terms with demiromantic, gray romantic, and you can check out more terms as well on asexuality.org. There are various labels that fall underneath or in between or combine these different labels or give specific experiences. We'll have even more refined definitions sometimes. You can check all of that out, and we'll also go into this more in depth when we have our ACE lecture, ACE and BI lectures. Okay. There's also, apparently I didn't add the slide version that has not, so we've gone through two of our readings. I want to also go through the third reading that we had. I have some slides around two-spirit identities and some resources. And let me pull that up. Sorry about this. I thought I had the other version open. Okay. So there we go. Maybe not. So I will just talk through it. So I wanted to highlight also the third reading, which was a zine that was published out in Canada. And it really talks about two-spirit identities and experiences of youth, some from various tribal backgrounds and tribal nations. So this two-spirit is a term that's used as an identity term by in Indigenous communities very broadly, but each tribe may have a different definition of what two-spirit means. Sometimes two-spirit is focused on how people see gender being embodied, literally as having both male and female spirits being in identities within the self. And other times it's also attached to sexual orientation. People can identify as both two-spirit as well as LGBTQIA and various permutations, and you can see that in the zine reading that was assigned. I think it's important to really center here first-person experiences and to note the different tribal and cultural contexts that are present, and to also really emphasize the importance of decolonizing understanding of sex, sexual orientation, and gender identity. There are a few other resources that I'm going to post as well that include, one of which includes the definition of two-spirit, which a lot of other authors are sort of reluctant to do because of the variation and diversity. and the idea that perhaps we don't need to have strict definitions of things in a kind of a more westernized way of knowing. It doesn't have to apply. So I think we can talk through this as well when we get into our course discussion on Monday of next week, after we chat some with Dr. Carl Street, who will be our guest lecturer. So hopefully this is a helpful overview and background of different terminology, and happy to take questions. We'll chat in class. Feel free to message me or Dylan or Otto about this lecture or other things, and look forward to seeing you next week.